Are you tired of waking up every night, stumbling into the bathroom with a sense of dread, wondering, is this the inevitable decline of age? Perhaps you've resigned yourself to the idea that men past 60 simply lose intimate vitality and control, left only to endure silent frustrations and unspoken embarrassment. But as Dr. Lauren Pierce, renowned European andrology specialist, will show today, the reality is far more hopeful and profoundly transformative. In her clinics across Frankfurt, Paris, and Milan, Dr. Pierce has witnessed thousands of men reclaim health, confidence, and even joy simply by understanding, confronting, and correcting the hidden habits and structural factors that undermine prostate health. This journey begins with Georg Müller, a retired architect from Berlin, a man who went nearly a decade accepting the myth that reduced drinking in the evenings would protect his bladder. Like countless others in France, Italy, and Scandinavia, he cut back on water, only to find his urine growing concentrated and acidic, irritating the sensitive bladder mucosa. Scientific studies in German urology have demonstrated that chronic dehydration drives up the risk of benign prostatic hyperplasia, BPH, making nocturia and urgency worse by creating a cycle of constant irritation and inflammation. The solution is surprisingly simple and profoundly scientific. Throughout the day, drink small, regular sips of water, maintaining a clear, pale yellow urine. This practice, confirmed in peer-reviewed European trials, stabilizes the urothelium, reduces osmolarity, and restores homeostasis to both bladder and prostate. Let us turn to Stefan Meyer of Vienna, whose sedentary office lifestyle kept him seated for 12 hours daily. After years of persistent pelvic pain and progressive urinary symptoms, Stefan's investigation revealed the pernicious effects of chronic pelvic stasis. Modern studies using Doppler blood flow mapping in Austria and Switzerland indicate that reduced pelvic blood supply, venous congestion, and impaired lymphatic drainage lead to glandular edema, increased interstitial pressure, and ultimately, prostatic inflammation. Physical therapists and movement specialists across Europe now champion the 30-minute rule for sedentary workers. Every half an hour, rise from your chair, perform dynamic stretching, walk to the kitchen, or peer out the window, thereby activating pelvic musculature and restoring microvascular circulation. These micro-exercises, including squats, lunges, and short walks, have been shown by randomized controlled trials in Sweden to reduce international prostate symptom scores, IPSS, by 25% over 3 months. Next, Luca Rossi, a Milanese journalist habitually fueled by espresso and English black tea, discovered the double-edged sword of caffeine. Although caffeine is a widespread European stimulant, its pharmacological action as a diuretic and bladder irritant severely exacerbates LUTS, lower urinary tract symptoms. The smooth muscle of the bladder neck and prostate contracts more tightly under sympathetic stimulation, resulting in incomplete emptying and residual volume. Urological research at the University of Padua highlights that limiting caffeine to one morning dose and substituting subsequent cups with decaffeinated coffee or herbal teas, such as chamomile, peppermint, or nettle infusions, leads to a measurable decline in overnight urinary urgency and frequency. Within 2 weeks, Luca's symptomatology improved, as confirmed by uroflowmetry diagnostics. Food, too, plays a decisive role. David Smith, a London taxi driver, relied on chips, fried meats, and processed sandwiches. Over time, his androgen profile, analyzed through serum testosterone and estradiol, shifted unfavorably, reflecting endocrine disruption induced by excess trans fats, oxidized lipids, and chemical preservatives. A major Dutch study published in the Rotterdam Urology Journal establishes that dietary patterns high in refined fats, processed meats, and energy-dense foods correlate with hypogonadism, increased estrogenic activity, and potentiated risk of prostate enlargement. Conversely, a Mediterranean regimen, rich in omega-3 fatty acids from wild-caught salmon, sardines, olive oil, green vegetables like broccoli and spinach, berries, bilberries, strawberries, avocados, and nuts, reverses the inflammatory milieu, improves hormone balance, and reduces prostate symptom burden. David's adherence to nutritionist-designed plans resulted in normalized serum testosterone and improved sexual function, confirmed at Guy's Hospital Endocrinology Laboratory. But physical health is not solely about what is consumed. It includes behavioral patterns. Alexandra Moreau from Lyon frequently ignored the urge to urinate during lengthy business meetings, unaware that chronic overdistension may overstretch the detrusor and compress the central gland. The bladder, under excessive pressure, exerts mechanical force on the prostate, promoting microtrauma, epithelial damage, and chronic inflammatory changes. The French National Urological Association recommends prompt voiding at the earliest sensation of bladder fullness, prioritizing functional preservation over social convenience. Dr. Lauren Pierce's patients learn to listen to bodily cues, recognizing that the avoidance of habitual holding prevents urinary retention, infection, and progression to more severe prostate disease. Environmental factors such as tobacco exposure remain a critical variable, highlighted in the case of Peter Johansson from Stockholm. Even as a non-smoker, working in a confined office with colleagues smoking cigarettes exposed him to secondhand polycyclic aromatic hydrocarbons, nitrosamines, and particulate matter. These toxins, tracked via biomarker research in Danish epidemiological studies, constrict microvasculature, diminish oxygen delivery, and induce a pro-inflammatory state that fosters glandular degeneration. Peter's recurrent prostatitis episodes resolved only after he relocated to a smoke-free workspace. For active smokers, Dr. Lauren Pierce collaborates with European smoking cessation clinics, employing pharmacologic aids like varenicline, nicotine replacement therapy, and cognitive behavioral support to achieve lasting abstinence, markedly reducing both cancer and BPH risks. Equally vital is proactive medical monitoring. Eric Schneider, a teacher in Munich, avoided annual prostate checkups for 10 years, only presenting with painful symptoms indicative of advanced glandular hypertrophy. European clinical guidelines, as endorsed by the EAU and validated in multicenter studies, recommend annual measurement of serum prostate-specific antigen, PSA, digital rectal examination, DRE, and when indicated, multiparametric MRI, or transrectal ultrasound for anatomical assessment. Early detection permits risk stratification, distinguishing between indolent hypertrophy, focal inflammation, and early neoplastic change. Dr. Lauren Pierce emphasizes that patients diagnosed in early stages often require only lifestyle modification and conservative pharmacologic intervention, sparing them the burden of chronic medication or invasive surgery. Olaf Lund, a Copenhagen chef, demonstrates the dangers of excessive red and processed meats. By switching from daily ham and sausages to proteins like Norwegian salmon, skinless poultry, lentils, and beans, and incorporating high-fiber grains, Olaf saw notable alleviation of his urinary symptoms. European nutritional guidelines stress not only the reduction of processed meat intake, but also the inclusion of anti-inflammatory phytonutrients, carotenoids, and flavonoids for comprehensive cellular protection. In Eastern Europe, Blaise Nowak, a former Polish athlete, developed abdominal obesity following retirement, accompanied by estrogenic symptoms and sexual dysfunction. Adipose tissue is now recognized as a dynamic endocrine organ producing pro-inflammatory cytokines and increasing aromatase activity, an enzyme catalyzing the peripheral conversion of testosterone to estrogen. Clinical research in Warsaw's National Endocrinology Center demonstrates that a waist circumference above 102 cm directly predicts lower serum T and increased prostate growth. Blazege's reversal involved daily brisk walking, replacing sweetened sodas with mineral water, and expanding his repertoire of leafy greens and insoluble fiber. Within 2 months, his waistline shrank, inflammation markers, CRP IL-6 decreased, and prostate volume returned toward normal. Finally, Nicholas Bauer, a Swiss entrepreneur, suffered from relentless stress, insomnia, poor dietary habits, and burnout. Neuroendocrine studies in Zurich highlight how chronic stress elevates serum cortisol, suppresses testosterone production, and promotes pelvic tension. Dr. Lauren Pierce prescribes evidence-based stress management. 10 minutes of mindful breathing, progressive muscle relaxation, and social support each day. The integration of mindfulness techniques with cognitive behavioral therapy and men's support groups has yielded statistically significant improvements in psychological resilience and reduced LUTs, confirmed by multi-site cohort studies. Modern medicine offers nuanced, tiered solutions tailored to the specific clinical stage and needs of every man. For benign prostatic hyperplasia, the medical armamentarium begins with watchful waiting and lifestyle modification for mild symptoms. First-line pharmacological therapies include alpha-adrenergic blockers, e.g., tamsulosin, 5-alpha reductase inhibitors, finasteride, dutasteride, phytotherapeutic agents, saw palmetto, Pygeum africanum, and combinations thereof, as guided by EAU protocols. For erectile dysfunction, PDE5 inhibitors, sildenafil, tadalafil, vardenafil, are available under clinical supervision. For refractory symptoms or confirmed anatomical obstruction, minimally invasive interventions shape the cutting edge of European urology, like the Resume system, which uses convective water vapor energy to ablate excess tissue and relieve obstruction in BPH. Clinical data from multi-center European trials show significant improvement in American Urological Association symptom scores, urinary flow rate, Qmax, and prostate volume after Resume, typically performed under local anesthesia in an outpatient setting, preserving sexual function and reducing perioperative risks. The Da Vinci robotic-assisted prostatectomy, pioneered by leading urological surgeons such as Dr. Medir Christian Wagner and Dr. Jörg Zinke at Prostate Center Europe, leverages high-definition 3D visualization and tremor elimination for precision excision. This technology dramatically reduces operative complications, incontinence, and impotence compared to traditional open approaches, now boasting over 20,000 successful procedures. Advanced thermal and laser-based modalities such as holmium, HOLEP, and thulium laser enucleation, THULEP, are particularly effective for large prostates, featuring short catheterization times, decreased intraoperative bleeding, and faster recovery. These interventions mechanically remove prostatic adenomas while sparing adjacent structures, delivering outcomes equal to or superior to TURP with fewer side effects, as confirmed by meta-analyses in Swiss and Dutch institutions. For appropriately selected men, prostate artery embolization, PAE, offers a non-surgical solution. Under local anesthesia, interventional radiologists thread microcatheters through the radial artery, using fluoroscopic guidance to deliver embolic microspheres directly to prostatic arteries, inducing ischemic shrinkage of the gland. Published outcomes from Cedars-Sinai and European centers show dramatic improvement in voiding function, minimal risk of impotence or incontinence, and rapid return to daily activities. A new frontier, high-intensity focused ultrasound, CHIFU, uses energy beams to precisely obliterate focal prostatic lesions, preserving surrounding nerves and tissues, resulting in preserved continence and sexual function. Experts caution that not every candidate is suitable, but those treated see remarkable quality of life gains. Crucially, medical management must include annual systemic assessments, serum PSA, DRE, endocrine panels, total, free testosterone, LH, FSH, estradiol, cardiovascular screening, lipids, glucose, blood pressure, and metabolic risk evaluation. Sleep hygiene is foundational. Block blue light exposure 2 hours before bedtime, use amber lenses, maintain consistent schedules, and support with magnesium and adaptogens as indicated. Nutritional science highlights the Mediterranean diet, rich in omega-3 fatty acids, olive oil, high-fiber grains, green leafy vegetables, cruciferous vegetables, broccoli, kale, tomatoes, berries, nuts, seeds, and avocados, as the gold standard for reducing both cardiovascular and prostate pathology. Pumpkin seeds and Brazil nuts aid symptom control in BPH. Asian mushrooms, green tea, and cayenne pepper provide potent anti-inflammatory properties, increasingly incorporated in European dietary plans. For mental well-being, adherence to psychological interventions, CBT, sex-positive counseling, and structured support groups improves emotional and relational outcomes in men facing prostate-related challenges. The pathway to lifelong prostate health is not linear, but with expert direction from Dr. Lauren Pierce and inspired by her European patients, every man can take charge of his well-being. Start today with conscious hydration, regular movement, mindful nutrition, and proactive medical care. Schedule annual checkups with your urologist, reduce processed food and tobacco exposures, create moments of mindful relaxation each day, and remain vigilant for the subtle signs that indicate a need for medical attention. If this exploration has resonated with you, please like, share, and comment with your home city, Hamburg, Milan, Geneva, Warsaw, or Vienna. Subscribe for ongoing medical insight from Dr. Lauren Pierce, and connect your journey with the thousands of European men who have found not only hope, but a renewed sense of vitality and confidence. Remember, your health, happiness, and masculine vigor are not lost to age. They are found in knowledge, action, and community. For individualized guidance, review the European Association of Urology guidelines and seek out multidisciplinary clinics where urologists, radiologists, nutritionists, and mental health professionals collaborate for your complete care. There has never been a better time to break free from the myths, embrace science, and begin a new chapter of holistic, empowered living.